Hi everyone, good morning. I'm Shivani Sahai and I'm so glad to be with you all to talk about the impact approach at our fund. Our philosophy at Quadria is to drive measurable and positive impact alongside generating compelling financial returns. Our goal is to ensure a sustainable impact, one that is inherently and intrinsically linked with the business model of the companies that we're investing in. As a fund, our focus is on quantifying impact and on maximizing value. We have a global mandate with an Asia focus. While the year 2023 focused on applying a systematic impact management approach through our IMM framework, it also allowed us to learn from our data and enhance our processes further. 2024 marked a significant milestone for us with the completion of our first ever impact verification, affirming the effectiveness of Quadria's impact management and measurement framework. We're investing for a lasting change, aiming to build a resilient and forward-looking portfolio that delivers sustainable returns over a long period. The intended impact looks at our core impact pillars, which is to make sure that healthcare is more accessible, it is more affordable, we're enhancing the quality of healthcare in the region, and raising awareness of healthcare outcomes. Supported by regional partnerships and collaborations, we want to ensure that the healthcare value chain effectively benefits from the impact generated by each portfolio partner. To talk about some of the impact highlights, we take immense pleasure in commemorating a significant milestone for us at Quadria, a decade of impact investing. Through our journey, we have achieved numerous outcomes, including very recently becoming signatories to the UN Principles of Responsible Investment and the Operating Principles of Impact Management. Here, I'd like to talk about the approach through our IMM framework that we take by applying our very proprietary impact scorecard to all the investments that we evaluate. So I'll talk about three examples, one at the time of investment, one during the ownership phase, and third during the exit phase. At the investment phase, the very recently invested company is Nephroplus, also there on the panel with us. It's the largest network of dialysis clinics in Asia, operating about 450 centers across 250 cities in India, Uzbekistan, Philippines, and Nepal. We used our impact scorecard to evaluate the investment with accessibility and affordability standing out as its key strengths. With over 70% of its centers in Tier 3 and smaller locations, Nephroplus is addressing a significant supply-demand gap. It's providing high-quality dialysis services at an affordable cost, which is much lower than the developed countries. Moving on, the next one is Medibuddy, again on our panel next. In contrast, it excels in its commitment to improving access and raising awareness about healthcare outcomes. As a digital healthcare platform, it is empowering underserved communities, particularly in the Tier 2 and Tier 3 regions, with access to high-quality healthcare. This app provides quality healthcare at a significantly lower price compared to traditional private healthcare models. Using our scorecard, we gave it a score of 3.7 as an anticipated at exit out of a total score of 5. Lastly, I'll also like to cover a company that we've exited very recently, which is FE Hospital in December 2023, where we applied our framework to assimilate the impact we've been able to generate at the time of exit. Over time, the hospital group has enhanced patient access and raised service and quality standards. Through strategic alliances, FE has led an enhanced footprint along with establishment of centers of excellence which have improved quality standards through best-in-class accreditations. With that, I'd like to jump into our impact video for 2024.
In every corner of the world, healthcare is the heartbeat of our communities. It is where hope begins and healing takes place. Improvements to healthcare and the sustainable development of an economy are inextricably linked. But for many, access to quality healthcare remains out of reach. Millions in Asia struggle with barriers to essential healthcare, from lack of infrastructure and resources to geographic and financial constraints. These aren't just numbers, they are real stories of real people. At Quadria Capital, we believe private capital can play a crucial role in providing accessible, affordable, and high-quality health services while easing the burden on our health systems.
I'm Kamal Shah, co-founder of NephroPlus, Asia's largest dialysis services chain. Over the past few decades, kidney diseases have surged across the world, especially in South and Southeast Asia. But dialysis services have not kept pace, especially in Tier 2 and Tier 3 cities. In India, many patients spend $3,000 to $4,000 on treatment every year, often more than that they earn. It's not sustainable. We started NephroPlus in 2009 with one mission: to bring high-quality, affordable dialysis services to more patients. Fast forward to today, we have over 440 centers across India, the Philippines, Uzbekistan, and Nepal. Our goal: to offer dialysis treatments at lower than usual cost in partnership with local governments. Our partnership with Quadria has been a real meeting of the minds. Their understanding of healthcare and their Asian network will help us in accelerating our growth and reaching more patients. It gives me great personal satisfaction knowing that we conduct over 3 million dialysis sessions annually across the region. And I feel we're just getting started.
My name is Neil Prasad Sharma. I have been here in dialysis since 18 July 2023. So when compared to other hospitals, I find service and quality and the price is even affordable when compared to others. So because the financial relief is much required with dialysis, we have selected
Abra, Amit, thank you so much for being here today. It's my pleasure to be here to find out more about Quadria Capital. Abra, can I start with you? Can you define what Quadria's mission is?
At Quadria Capital, we believe that access to healthcare is a fundamental human right. We believe that by empowering and partnering with leading healthcare businesses, we can help patients lead better, healthier lives while building sustainable companies for the long term.
Amit, can I come to you? Because part of the point of Quadria Capital is the social impact. How do you measure that?
Supporting lasting change is really at the heart of how we define and measure success. We use global standards to guide us, and we have developed our own impact management framework to stay true to our impact and ESG commitments. Now, this framework helps us to evaluate potential investments along 4 key dimensions. First, will it make healthcare more accessible? Second, will it make it more affordable? Third, will it improve the quality of care? And fourth, will it raise awareness of healthcare solutions? Now, for each investment, we use an impact scorecard to measure current and anticipated performance across these 4 dimensions. This enables us to measure and demonstrate our impact throughout the investment lifecycle.
Particularly when you look at healthcare companies, what are you looking for in that dimension, ESG?
Quadria believes that responsible and impact-oriented investment is critical to the long-term sustainable value creation. Our team identifies ESG risks before making any investments. It has become a lens through which other priorities are viewed by us.
And Abra, what cumulative social impact is Quadria having?
Since the founding of Quadria Capital, we have touched over 230 million lives across South and Southeast Asia. And we have provided access to essential healthcare services for over 45 million patients. We are dedicated to underserved communities, with over 70% of the nearly 500 healthcare facilities in our portfolio strategically located in Tier 2 and Tier 3 markets, where the need is the greatest. We've also ensured the production of over 19,000 pharmaceutical products, significantly enhancing access to affordable medications. Our companies are committed to inclusivity, employing over 59,000 people, with women making more than 45% of the workforce. As we look to the future, our ambitious goal is to impact 1 billion lives by 2030. With the support of our investors and our portfolio companies, we are confident of turning this vision into a reality.
Nama saya Yuli Sarkiat. Saya adalah salah satu direktur di Rumah Sakit Hermina, salah satu grup rumah sakit terbesar di Indonesia. Indonesia adalah negara ranking keempat dengan 278 juta populasi. Dahulu, pasien seringkali harus melakukan perjalanan jauh ke kota-kota besar untuk mendapatkan layanan kesehatan. Dengan dukungan Quadria, Hermina telah berkontribusi memenuhi kebutuhan pasien dan kini telah berkembang menjadi 48 rumah sakit di 33 kota di Indonesia. Hermina sekarang sudah melayani lebih dari 8 juta pasien per tahun dengan tim yang terdiri dari 4.300 dokter dan perawat. Model kemitraan kami yang unik di mana kami berpartner dengan sekelompok dokter di setiap rumah sakit berdiri telah membuahkan hasil yang baik. Hal ini telah memungkinkan perusahaan untuk terus kolaborasi dan memotivasi staf medis yang jumlahnya masih terbatas di Indonesia.
Rumah sakit Hermina menerima pasien dari berbagai macam penjaminan. Termasuk di dalamnya adalah program Jaminan Kesehatan Nasional atau yang kita kenal dengan JKN yang dikelola oleh BPJS. Lebih dari 65% pasien Hermina adalah pasien JKN BPJS. Sejak investasi Quadria pada tahun 2020, Hermina telah melayani lebih dari 20 juta pasien, menambah 2.300 tempat tidur, dan bahkan membuka 4.200 lapangan kerja baru dalam jaringan Hermina. Dan kami bersyukur karena Hermina memiliki mitra yang handal di bidangnya dan memiliki wawasan yang mendalam untuk mendukung tujuan kami, yaitu membuat layanan kesehatan yang berkualitas, yang mudah diakses dan terjangkau untuk semua orang.
We believe in impact in action. We are proud of the significant strides we have made over the past year. Looking ahead, we are more committed than ever to expanding our reach and contributing to impact solutions. At Quadria Capital, we are transforming healthcare through sustainability, one investment at a time.
Hi everybody. While we're getting the chairs set up, it is a delight to be here. I'll make a quick introduction to myself and our wonderful panelists. My name is Gaurav. I run a company called Dalberg, which for me it's really interesting to be on this panel because our organization is dedicated to helping clients optimize for social impact. So I was really delighted to see how Quadria thinks about this issue. But joining me today are some of the stars of the video that you saw. We have Vikram from Nephro Plus, we have Satish from Medibuddy, and then we have Raju from the IFC, all of whom have been helping think about driving impact as either investors or obviously as organizations that are delivering on the ground. And then of course, we have Shivani, where are you? Here we go, joining us as well. Wonderful. So I think the work is cut out for us because all of you have just had a lot of coffee. That means your heart rate is high. That means your expectations are also high, that we make this a bit of an interesting and spicy discussion. So here is what we're not going to do. I think this idea that, you know, when you get healthcare right, it creates social impact is a given. That's not a discussion we need to talk about much. That private capital is necessary or critical for us to extend services is also not a controversial conversation. So that's not what we are hoping to achieve out of this panel. What we're going to actually explore is how to do more impact. We know that private capital is going in. We know there are a lot of great companies in the private sector delivering healthcare services. The question is, how can we eke out more impact? And where is there a trade-off And where is there no trade-off at all? These are the kind of questions that we're going to explore. So let me actually start with Vikram and Satish. We saw a little bit about what both of your companies do, but frankly, if we brought any healthcare company onto this stage and said, how do you create social impact? Everybody has a story to tell. And so I guess my first question is, what is it that you do extra that is really prioritizing this idea of impact while delivering some fantastic returns? And maybe Vikram, we can start with you.
Sure. So NephroPlus, we run 460 clinics, dialysis clinics across 280 cities in 4 countries. When we started NephroPlus in 2010, the first clinic, in India, only the top 10 cities had access to dialysis services. Now, over the last 14 years, we have democratized the access, wherein people, instead of traveling 3 to 5 hours one way to a dialysis treatment, which is a chronic condition, I hope people here are aware, you need dialysis 3 times a week in order to survive. People were traveling 3 to 5 hours each way. We completely penetrated Indian market from the top 10 cities which had access. Now, NephroPlus, we ourselves have provided access to 240 cities in India. So 14 years, that's the access story and access to quality clinical care. And co-founder whom you have seen in the video, he's himself on dialysis for the last 27 years. He's 48 years old. So the combination of the business and the patient centricity driven by the co-founder, that has really helped us relentlessly focus on improving access into the non-metro cities. We could have built the same size of business with 50-50 split, but we always prioritize access over just growing another few clinics in the metro cities. So for us, right from day one, the focus has been how do we grow the access to first tier 2 cities, then tier 3 cities, then tier 4 cities, tier 5 cities. And I think that will continue. India has 638 districts. India is a large continent, it's not a country. And to go deeper and deeper into the tier 5, tier 6 cities takes enormous amount of bandwidth from the company's side. It's much easier to build same scale business in large cities. Much more tougher in the small.
And can you say a bit more about that? Every time you go down from tier 2 to tier 3 and now into tier 4, what had to change about your model to make something like that happen?
Yeah, in the top, in the metros and the tier 2 cities, the private side or the patients who can pay out of pocket is higher. But as you go down the tiers, you have to figure out innovative models like a public-private partnership project where you have to work with the governments. In India, for example, we partnered with Bihar, which is one of the poorest states in the country, wherein we are providing access to half of the state of Bihar, where we are going to the most remote geographies where even hiring human resources is an extremely tough challenge. But the model which works in tier 4, tier 5 is very different from what works in metros and tier 1. And the company has to adapt. We provide an incentive program for our human resources to spend a couple of years in tier 4, tier 5, because everyone wants to work in the metros and the tier 1, tier 2 cities, because everyone wants a good quality of life. So how do you hire human resources? Equipment, medical equipment is a commodity. You can just buy and put equipment anywhere in the world, but human resource is the major constraint in growing access to quality care.
Satish, let me come to you. What is that extra thing, especially in a space where there's a lot of success and failure? You've clearly enjoyed a lot of success. What has allowed you to deliver extra impact?
No, absolutely. So before I got started with MediBuddy, the first idea I have told it earlier also was to sort of build hospitals. Now the challenge with India is at the scale of like 1.5 billion people and the geography that we have, building infrastructure and trying to provide healthcare to all is just not a possibility. By infrastructure, I meant building a hospital, building a clinic like Vikram is doing. Now, what does it mean? So in a country like India, if you've gone and studied other businesses, it can be banking, it can be telecom. Banking, it's not possible to put a bank in every part of India and provide financial inclusion. The only way to do that is UPI. So exactly similar, India forces us to use technology, and that's where digital healthcare starts from. It's the only way to provide good quality healthcare to like 1.5 billion people. And the constraints that we have is you need high quality, but at low cost, right? In the US, you get high quality at high cost. So it's doable. So which means technology itself is the biggest leveler to figure out how to provide great access. And the second piece that I wanted to add upon was, a lot of people don't like AI, or they say, or doctors when I talk to, they say, hey, I don't like AI, or even patients sometimes say AI is not going to really make a difference. But the reason why I strongly believe it's happening and Medibuddy is able to make strides in that is there are just not enough doctors in the country, and you will need every doctor takes roughly 10 years to graduate out of school, and after that you need at least 15 years from there to become a very, very at least well-experienced person in the mind of the customer, right? You might be very good, but the customer should believe that you're a good doctor, which means very, very difficult to, let's say, manufacture that many doctors. So today, Medibuddy's AI system, which is called Clara, makes every doctor 3 times more productive, which means he's able to help more patients in less time. So in a different way, you're actually keeping quality very high, but the cost is also sort of controlled, right? At a very high level, the technology intervention along with the power of AI that you're bringing in creates a lot more value. Now, the other last piece I want to talk about was the kind of awareness that we can generate, right? I strongly believe in India and potentially a lot of Southeast Asian markets and let's say developing countries, every family will have a smartphone. And the smartphone is going to be their introduction to the world. Education is going to happen through that. Finance is going to happen through that. Healthcare is going to happen through that, which means in a family of 4 or 5, there's going to be one smartphone. And that means digital is the way to create awareness. We definitely need the infrastructure. So it's going to be a phygital approach, some digital, some physical. Even if they have to travel 5 hours, I would rather request them to talk to a doctor on a video call, get the right advice, and then might be travel, but follow up the pharmacies, the diagnostics locally, but the physical consultations at the hospital, right? And you can find the right mix between these two, and that's the kind of work that Medibuddy is doing.
And I'd love to, I'll come back to both of you around where do you do see some trade-offs in terms of having to achieve certain types of margins, and where you're seeing sort of health outcomes, where you could deliver more impact, with a different type of trade-off. So we'll come back to that. But Raju, this good segue to you as an advisor to on healthcare to the IFC, which has this dual mandate. Now, it's very easy with a dual mandate to say any healthcare investment in an emerging market feels like it's a great social impact investment. How does the IFC think about it? What constraints does it think about when it says, I want to get a commercial return, I want to create healthcare impact?
Good question, and you call it dual mandate. I call it double the stress on a daily basis, because when we look at investments, healthcare investment in emerging markets, this dual mandate of creating the social impact plus having that financial discipline, financial sustainability, that's a daily issue, and it happens because of few things, right? One is healthcare is not a happy spend, because everyone wants good healthcare at a much cheaper price. Nobody wants to spend money for healthcare, so that is a fundamental issue. So you want to keep it affordable, accessible. But I think beyond that, the biggest challenge is providing appropriate healthcare, because you can provide cheap healthcare at the expense of quality, at the expense of governance, at the expense of ethical practices, then it doesn't become an appropriate healthcare. So I think that is what we focus a lot on. How can we mitigate that risk of not providing that appropriate healthcare, especially when we look at emerging markets, when we look at tier 2, tier 3 cities, going beyond the metros, when we start investing in not the big players, but the smaller entities who are maybe family-run kind of businesses. They might be doing the right thing, but then when you look at a corporate governance structure or clinical governance structure, a lot of things are done very informally. That doesn't cut it, because especially when they scale up, they can maybe do a small clinic or a small 50-bed hospital, they can run it that way, but then if you want to grow the business, if we want to become a much bigger entity, some of these protocols and practices needs to be more institutionalized. So I think that's our challenge. So that's where IFC can play, and we are playing an important role of providing that support to these players, both in terms of investment support and also advisory and mitigating that risk. And so we do that very actively. So we have a very active team of not the investment people, but also an health advisory people. So we look at health quality, healthcare governance, ethical principles in healthcare, and benchmarking, which is another thing which we do to bring providers together, look at some of the indicators which they are measuring today, and anonymize it, standardize it, and go back to them and see this is where you are, how can you improve and stuff.
But let me push you to be sort of specific, or as an example, right? So where's an example of you saying no to something, even though from a risk-adjusted, I mean, a lot of governance questions can also just come into risk-adjusted return. Yep. So sure, if the law on governance, we put that aside. But where have you made calls as just as examples of saying no to a healthcare investment in an emerging market, even though it showed all the profitability signs, because you felt that it doesn't meet your impact criteria?
Right. So it could be a very simple example of, let's say, it make very good financial returns, but when you look at some of the practices of how they acquire patients,
I see. Right.
Maybe it is not done in the right way. How the patient gets referred into the hospital or the healthcare ecosystem this entity is running. So and that is something, if we can help them to change some of these principles, yes, it might be an opportunity there. But sometimes by nature of the geography and the nature of how the market behaves, there's only so much we can do. And then that's not an opportunity for us, although it's a very good financial story, but then it really doesn't do the right thing. So we will have to walk away from that. But if we can fix it, we would try and fix it and then make it investable as well.
Raju, we'll come back to you, but I'm curious about the metrics you guys look at that you feel might be even different from what many people report on. Now, Shivani, I think you're the only person I gave a heads up in terms of the question I was going to ask, and it was an hour ago because I thought this was possibly a borderline unfair question, but I'm going to ask it anyway. You're at Quadra Capital, you're trying to create impact and you're trying to create returns. Let's have a hypothetical where there is a fantastic, top quartile opportunity from a risk-adjusted return perspective in the healthcare space with some impact. It meets your minimum threshold. There's a second investment that is not quite at the exact commercial level. It's just below, but it is significantly high. It's in a space no one's really going into. There's a real opportunity to crowd in capital. These are the places that are often ignored, but there's something there. What would it take for Quadra to invest in the second and not the first in a world of limited capital?
Sure. So I think not a straight answer for that one, but definitely I think, like you said, the thresholds are there. There are impact scorecard where we will do that fair bit of initial assessment to determine whether it's passing our go, no-go criteria for both the investments. And I think even if I think impact is lesser in a few of our investments, our portfolio is not completely weighted in terms of equal impact distributed across all the companies. In a few where it's less, I think the objective is to see where we can create the value, where in terms of even the anticipated score that we're potentially seeing for the company. If we have certain value creation drivers, how are we able to deliver with the company, work side by side, impact team as well as the deal team? Where do we see potential impact lying? Because at the end of it, we are investing in scalable businesses so that when the business grows, the impact also scales. So I think to your question, I think it will be unfair to sort of say that we would weigh one over the other. Of course, as you see in even the video that we just showed, I think the two companies that we showed have a large impact, and of course, score very highly on the impact metrics also. But I think the fact over there is also how do we sort of improve it further? How can we bring in more synergies? How can we work together through partnerships, collaborations? And I think that will always be the fundamental sort of approach, where the deal team will also identify where is it the financial returns also making sense, but where we can bring in that additional value driver from an impact lens, even if it is less at the time of investment, where we can work together and work on it together. So
you back yourself to help make that change happen.
Yes.
Okay. I'm being told that all of you took too long on coffee, and so we have only a 1 or 2 minutes left. So my apologies, but if we can do a quick fire round. So first, to both of you, let's relax all margin constraints. All you have to do is break even at best, or at worst, I should say. What would you do in your business? What else would you do to serve, to create more impact in each of your businesses if there was none of these margin constraints?
None of the financial constraints?
You still have to break even.
Yeah, I think we would reduce our pricing in some of the markets to serve more. But fundamentally, I believe that you need to have a economically sustainable model to create massive impact. You can reduce the pricing in 20 clinics, 30 clinics, 50 clinics, but you can't do that at 500 or 1,000 or 2,000 clinics, right? I think you can pay a lot more to the healthcare clinical staff. If you look at Asia, the amount of effort that clinical staff puts in versus the compensation is abysmal. My driver earns more than a nurse, a 4-year degree nurse in the clinical space in India, right? So it's insane. If there is a way to increase price and pay the clinical staff more, or decrease price and serve more staff, more patients, I think it would be great. But I think it's a utopia, right? Practically speaking, it's very difficult. I think if you want to make more impact, I would encourage all the LPs in this room to force their GPs to focus a lot more on impact. It's the LPs' pressure on financial returns that GPs are delivering. So I think the key question is to the LPs here. Are they willing to sacrifice even 50 basis points to create more impact? I don't think it's a straightforward answer.
It's a great question. We should get them up on this panel. Satish?
Yeah, so see, my view is goodwill will take me. So when I was starting up, we had different viewpoints, right? And there's a lot of discussions on how a digital healthcare platform is able to scale as well as still make good financial sense, right? Now, this is a dichotomy and work that I had done beginning of 2014-15. I spent a lot of time in NGO trying to understand, and right, NGOs are heavily in healthcare and education. What I've learned very fast was goodwill will take you to 10,000 people, might be 100,000 people. But good business model will take you to like 1 billion people. Now, that clearly means that it's a challenging problem statement, but we need to find a solution where economics meets impact. Now that's how I personally believe, and my philosophy is that. Because I don't get excited when I'm able to help like 10,000 people, 100,000 people. You need to like help like 100 million people, right? Like 200 million people. In India, anything less than like 400 million people is not scale. And that's how I believe about it, right? Geo is 400 million, so anything less than 400 million is not scale. So what does it mean? Which means we need to find very different ways to approach the problem. And for some time when I was studying, the one thing that I also understand a lot more is about technology, right? You can really use technology to make enormous amount of difference. And if I want to slightly change it, I strongly believe the amount of investment that I do in the technology part of it is still less. Of course, I'm one of the highest in the industry, but I can still like significantly change it. So might be I will create a separate pool called the technology investment and don't put it in my balance sheet, don't put it in my P&L. And then if I could do that, you could significantly change quality, significantly change cost and pricing. At the same time, also deliver returns. And the technology stack is very costly, right? If I had to run a model that has to be built for India, itself will cost me like $25 million just on that model. Now, it's very difficult to put that. So I would bet that we should keep both as a problem statement, but deploy in my case, deploy in technology, that can make a lot of difference. It can be devices, it can be AI, it can be service model, it can be technology platforms, it can be SaaS ERP systems. Yeah.
Satish, totally agree. Good business can serve $1 billion. It's not clear that good business has to be profit maximizing. And I think the jury is actually very out on that. And that's an important question for us to agree, especially if you're going to ask LPs to cut by 50 basis points. Raju, quick one on interesting metrics you're chasing.
Just on a bigger realm of things, I think the key things which I personally like to see also is, and which we kind of preach and practice, is bring down the need for hospital care. I think that's the only way to have a sustainable and affordable healthcare delivery. Because unless, I'm not saying don't build hospitals, but treat the patient who really needs hospital care at the hospital, but you bring the care out of the hospital into early diagnosis, primary care, create that health system ecosystem, then patient gets treated at the right level of care, healthcare spend becomes affordable for the provider and the patient and the payer, and then that's a system which is sustainable, which will have the impact, which will have the economic sustainability, and as an overall achievement.
That's a great place to sum up. I'm sorry our time is up. Please thank our panelists for that fantastic discussion.